Hello everyone. Thank you so much for watching our videos. If you are enjoying our content, please hit that subscribe button below. Really appreciate all the support and views we've been getting recently. Today I wanted to show you a very interesting case. It's a patient of mine. He's been a patient about 8 months, and he came in with post-concussion syndrome issues. He actually went headfirst into the hockey boards when he was about 13 or 14, and he's been having post-concussion syndrome issues for about 5 or 6 years now. Now, what's interesting about this case, and a lot of my other patients say the same thing, their MRIs, their CAT scans, their blood work, they all come back fine and negative. So they're wondering if it's even possible to have neurological issues, misalignments in the neck, if their CAT scans and MRIs are all coming back clear. And the answer is 100% absolutely yes. You can have neurological issues and misalignments in the upper neck even if most of your scans and your x-rays and your MRIs are coming back clear. Now, one thing I want you to notice, which is interesting about this patient, is this patient actually fractured his neck, and I guarantee it happened when he went headfirst into the hockey boards here. Do you see this piece that's broken off right here of that spinous process? This was not documented in any of the x-ray reports that this young man had. It went completely unnoticed. So that's why I say it's important for all my patients to get a second opinion on all your x-rays and MRIs, because sometimes people miss things. And to miss something big like this, that's huge. That's a broken bone in your neck that should absolutely 100% have been addressed and told to him after he got that imaging done, which is pretty shocking to me. But I also wanted to go over another thing here too. So this patient's about 20 years old. He has a relatively healthy neck. There's not a lot of degeneration, arthritis. We're going to go over his disc here. So it's no wonder, besides the broken bone, it's no wonder why a lot of his imaging came back clear. His disc space are nice and healthy. He still has a pretty good neck curve. But I want to show you what I found, some of the red flags, and why he was feeling the way he was feeling, and how we were able to get him better. Now, most of this young man's problems are coming from the upper cervical spine, right around here, that atlas bone right here. Usually, this angle, the atlas plane line, is how the atlas bone sits under the skull right here. So this is the bone that meets your skull, and your brainstem is right here. Usually, this angle is about 15 to 20 degrees on most people. This young man's atlas plane line, we go right through the middle here, is about 38 degrees. That's almost double the normal measurement. His atlas is so far rammed up under his skull, it's cutting off the nerve flow and blood flow, and the brain can't communicate with the spinal cord and heal itself, causing a lot of his neurological symptoms. Now, this young man was dealing with headaches, blurred vision, dizziness, anxiety, and he has severe low back pain, which was unexplainable to him, and it happened after his injury. So I'm going to show you a couple things that I found and how we were able to help him. So not only is this measurement right here alarming, it tells me that the atlas most likely went forward under his skull pretty far. Now, 2 millimeters in the upper cervical world is a pretty big misalignment. So right here on the right side, this is his skull and this is his atlas. His atlas should be all the way down here. So now remember, I told you 2 millimeters is a pretty good misalignment. That's why it's so easy for these misalignments to become unnoticed, because not many people are analyzing the x-rays like upper cervical chiropractors do. That's about 4.5 millimeters on the right, which is a huge misalignment. Remember, I said 2 is pretty big. Now we're going to walk it over here to the left side. We're going to do another measurement. This is the top of the atlas here. This is the skull. One more measurement on the other side, 4.4. Those are 2 huge misalignments on both sides of his neck that are cutting off nerve flow and blood flow and causing a lot of neurological dysfunction in his body. Also, when this top bone goes off center, it hikes up a shoulder, it hikes up a hip, and causes a short leg. So it can also cause a lot of low back pain too. So what we had to do is we had to slip this bone back on both sides to get the nerve flow and blood flow back again. He also had a couple misalignments at C2 and C3, a tiny misalignment, C2 on the right here, anterior, and C3 anterior on the right. So his main issue was definitely coming from this anterior atlas bone on both sides. And when it goes out on both sides, it causes an extreme amount of pressure around the brainstem. And like I said before, it causes a lot of neurological issues. Now, this patient went 7 years without being told that he had an upper neck misalignment. He went 7 years being told that his MRI was fine, his CAT scans are good, we don't see anything on your x-rays. So I encourage you, if you are going through something like this where you are having an extreme amount of pain, neurological issues, blurred vision, dizziness, vertigo, brain fog, headaches, a lot of nausea and digestive issues, get your upper cervical spine checked out and have it done by an upper cervical spine specialist, because as you can see from here, this has gone unnoticed for 7 years. His neck looks relatively healthy minus this fractured bone right here, which also went unnoticed, which is also why you should get a second opinion on your x-rays. But please, everyone, if you're struggling with these symptoms, get checked by an upper cervical specialist. It could save your life and you can get your life back. My name is Dr. Kevin Pecca. I have an office in West Orange, New Jersey at Montclair Upper Cervical. Thank you so much for watching this videos. If I can help you in any way, please reach out in the comments. I would love to be of service and make some more videos for you guys. If you want me to make any more videos about anything that sparks your interest upper cervically, please leave them in the comments below. And thank you everyone for watching.